All right, so this is part 3 of the birth terms defined, and we are on jaundice, something that you've probably heard about, but maybe don't know what it means. I know I didn't know what it means. So this is a yellow discoloration of a newborn's skin and their eyes, somewhat common. While jaundice is usually harmless, it's best to let your pediatrician know if you suspect that your baby has jaundice. To check, you just lightly press your finger against their forehead, and if the skin turns yellow, they might have jaundice. It's often simply treated by placing baby in the light of a window for around 10 minutes twice a day. Lactation consultant. I love lactation consultants. These are professional breastfeeding specialists that are trained to support mothers with breastfeeding. Issues like latching, positioning, milk production. Many hospitals thankfully employ lactation consultants who will check in with moms sometimes right after they deliver to help them begin breastfeeding. And there are also tons of lactation consultants that will make house calls. So if you're having any trouble with breastfeeding, or you're wondering, like, is this normal? Should it hurt this much? Go ahead and contact a lactation consultant. I recommend hiring a board certified lactation consultant. That acronym is IBCLC. Okay, Lanugo. This is the fine, soft hair that covers the newborn in the womb. It helps the protective layer of vernix, which I'll define soon, stick to the skin. This hair usually sheds around 7 or 8 months of gestation, but it sometimes sticks around for many weeks after birth. So, and Lanugo, not surprisingly, it's most commonly seen on preemies because it hasn't had time to fall off yet. Okay, linea nigra. This is the super sexy dark line that some women get from the belly button down to the pubic hair. And it's actually always there, but it's usually so faint you can't see it. And so the shift in hormones that causes so many fun changes during pregnancy is what causes that line to darken during pregnancy. It often fades after baby is born. Okay, next, Lochia. So this is the vaginal discharge that occurs after birth. It usually contains a whole bunch of blood, mucus, uterine tissue, and it typically lasts for 4 to 6 weeks. And it usually isn't too heavy after the first week. Talk to your care provider about what is too heavy, and expect lots of Lochia, especially the first 2 or 3 days after labor. And again, it's nice to talk to your care provider about this so you don't freak out, so you know what to expect. You will have like big old diaper pads on for the first few days after labor. Okay, meconium. These are babies' first poops, which often look like a greenish black tar. It doesn't have any scent, and it's actually sterile. It's composed of everything that the baby swallowed in the womb, like skin cells, lanugo, mucus, amniotic fluid, bile, water. And sometimes a baby has a bowel movement in the womb, which would present as discoloration in the amniotic fluid. So if your water breaks and it's discolored, let your care provider know. If this occurs and you're having a hospital birth, a NICU team will definitely be present when baby is delivered in case they've aspirated or breathed in any of the meconium. Mucus plug. So this is the thick jelly-like cervical mucus that's lodged between your cervix and your uterus. It helps keep bacteria, viruses from entering the uterus, and it comes out as your body is preparing for labor. Sometimes it's also called a bloody show. You'll never be so excited to see a whole giant wad of mucus come out of your vagina. Sometimes it happens well before you actually go into labor. I had a mom that had the mucus plug come out a week before she went into labor. So it coming out doesn't always mean that you're going to have the baby immediately, but always let your care provider know when that mucus plug comes out. It's typically pretty clear, but sometimes it has a bit of pink, red, yellow, brown tinge to it. If a significant amount of red blood comes out with it, go ahead and let your care provider know. Again, it should mainly be clear. Okay, next up, NICU. So this stands for Neonatal Intensive Care Unit, and it's the area of the hospital that baby will go to if they need any specialized care. Next, non-stress test. This is a test done in the hospital to confirm baby's health when they're in the womb. It's non-invasive. It only consists of baby's heart rate being monitored. This is something that's usually done, once you hit your due date, especially 41 weeks. Like my care provider, for example, said, if you get to 41 weeks gestation, we'll start doing a non-stress test every day to make sure the baby's good. If, for example, I had a non-stress test and the health of my baby seemed tenuous, they probably would have recommended induction. Okay, Nuchal Hand, also called compound hand. So this is when baby's hand is by their face when they're born. My son did this to me, and it made pushing super hard. It can make the pushing, that part of labor, take a lot longer. It's not fun. I sounded like a wild animal when I was trying to push him out. All right, Nuchal Hand. There's also Nuchal Cord. So this is when baby's umbilical cord is wrapped around their neck. While it sounds scary, it's actually pretty common and it's rarely dangerous. According to a study published in Maternal Health and Neonatal Perinatal, 10 to 29% of fetuses actually experience Nuchal cord. My son also had this, Nuchal cord and Nuchal Hand. All right, oxytocin, this is also called the love hormone. It's produced by the hypothalamus and secreted by the pituitary gland. It supports sexual reproduction, childbirth, bonding, and also causes contractions. It is what stimulates contractions and keeps them going. It's also released when baby nurses, and this is a phenomenon that's especially helpful right after birth because it causes the contractions that help the uterus shrink back down to size. All right, next up, the pelvic floor. This is a group of muscles in the floor of the pelvic area that stretch like a trampoline from the tailbone to the pubic bone. They support the bladder, the uterus, the colon, the urine tube, the vagina, the bowels pass through these muscles. And so keeping them strong helps to prevent, circumstances like wetting your pants when you laugh or you sneeze, or you just walk with a bounce in your step. And it also helps to prevent surprise flatulence, something that I still experience. Yay. Okay, so because no one wants a saggy trampoline, it's important to strengthen those muscles with Kegel exercises, that like pulling up and tightening. But when you're practicing those Kegel exercises when you're pregnant, it's equally important to focus on how to relax those muscles and feel them kind of spread and release, because that's what we need to happen during birth. So if you have these like super tight, strong muscles that don't know how to release and relax, it's going to be harder to give birth. So it's this fine line between strengthening, but also focusing on releasing and relaxing. And if you have a lot of pelvic floor issues after labor, there are amazing specialists that can give you exercises beyond Kegels to strengthen that pelvic floor again. All right, perineal tissue massage. So this is a massage that feels nothing like a massage, and it probably shouldn't be called a massage. It should really be called perineal tissue stretching. And this is a stretching technique that helps to prepare your perineum for that expansion during birth. And I have a video on this channel called something along the lines of how to do a perineal tissue massage, I assume. And this helps the perineum be more pliable, more flexible during childbirth, and it helps to prevent tearing. So I highly recommend watching the video I have on here about how to do the perineal tissue massage, and begin doing it around weeks 34 to 36 of gestation. Okay, perineum, I mentioned this in another video, but it is the area between the front of the vulva and the anus. If you're going to tear during childbirth, this is usually the area. Pitocin, this is a synthetic version of oxytocin. It's sometimes given to induce contractions. It's really the most common drug that's used to induce labor. It's administered through an IV and is gradually increased until the mom is having regular contractions, typically every 2 to 3 minutes. It can make contractions unnaturally strong and can sometimes lead to the need for an epidural. However, it can also be turned off at any time. I've seen Pitocin used really successfully in help moms. I've also seen it used, and it creates a cascade of intervention. So I recommend doing a lot of research about Pitocin, asking your care provider about it so you can make an informed decision if it's something that's offered to you. I'm also going to be making a video sometime soon about the truth about Pitocin. All right, placental abruption. This is a very rare occurrence where the placenta prematurely detaches, either partially or completely from the wall of the uterus. This sometimes can cause really heavy bleeding and a lack of oxygen for the baby. So if this happens early in pregnancy, the baby will be really closely monitored through an ultrasound. And if it occurs later in pregnancy, the baby will likely be delivered through C-section. All right. Placenta Accreta. This is when the placenta grows too deeply into the uterine wall. This often prevents the placenta from detaching completely from the uterus after baby's birth, which could cause hemorrhaging or bleeding out. In this situation, the baby is usually delivered through cesarean section, and in severe cases, very severe cases, a hysterectomy or the surgical removal of the uterus is needed, but again, very rare. Okay, placenta previa. So this is when the placenta is covering all or part of the cervix. The primary symptom of it is vaginal bleeding, often pretty bright red blood. It usually is not accompanied by pain. Sometimes placenta previa resolves itself. It just naturally moves away from the cervix during pregnancy, but if it does not resolve by the time mom is full term, a C-section will usually be needed. And the placenta, you probably know what this is. It is a fascinating organ that grows in your uterus during pregnancy, obviously. It provides nutrients and oxygen to the baby. It helps to remove waste from baby's blood through the umbilical cord. Ideally, it attaches to the top or the side of the uterus, and it's made from tissue that came from the embryo, and it's usually birthed about 30 minutes after the baby. While there has not been extensive research about the benefits of consuming the placenta after birth, many believe that consuming it can actually minimize symptoms of postpartum depression, increase the release of oxytocin, enhance milk production, and restore iron levels. So if you're into this idea, cool, but make sure you use somebody that can encapsulate the placenta. I don't know how I feel about people eating it, like cooking it, which is something that some people do. Most people have it dried and encapsulated in pill form, which is something I think I'm gonna try next time I have a baby. But make sure you find somebody that's really professional, utilizes really stringent protocol about handling the placenta. And if you have group B strep, talk with your doctor about the potential risks of consuming a placenta that has come into contact potentially with GBS, because that could cause a bit of risk. Okay, posterior or sunny side up baby. This means that baby is head down, but their face is pointed towards the front of your body instead of your spine, instead of pointed towards your spine, which is the optimal position. So laboring with a baby in the sunny side up position can cause back labor, a lot of pain in your back. It can elongate labor. On this channel, I have a video about how to turn a sunny side up baby. All right, postpartum, this means the period following childbirth. Postpartum doula, I like to call them earth angels. They're amazing. These are women that are trained to come in and support mom in the few weeks or even months prior to baby's delivery. They help with cooking, cleaning, baby care. They can make a huge difference. Postterm baby, this is a baby born after 42 weeks gestation. Pregnancy mask, this is also called melasma, and this is a type of hyperpigmentation that causes like tan or brown patches on the face. You can help to minimize it by wearing organic zinc oxide sunscreen because the sun can exaggerate this pregnancy mask. All right, preterm labor, this is when a baby is born between weeks 20 and 37 of gestation. Prodromal labor. Dun, dun, dun. This is a really frustrating phenomenon of early labor that you can feel a lot more than a Braxton Hicks contraction. But it actually isn't doing much to dilate the cervix, so it's very frustrating. You're moving through labor, you're having to utilize your pain relieving techniques often, but it's not doing much to dilate you. Let's see, relaxin. This is a hormone secreted by the ovaries, even when the woman isn't pregnant. But it is also produced by the placenta when she is pregnant, so she has more of it during pregnancy. These higher levels help to relax the walls of the uterus, minimizing the chance of contraction early on in the pregnancy, and it also helps to relax the ligaments in the pelvis, and it helps to soften and widen the cervix in preparation for labor. If you have questions about any of these terms, let me know in the comments below.